Hi guys, what's up? Our today's topic is about winging of scapula. So winging of scapula is due to the injury to long thoracic nerve. It leads to the paralysis of serratus anterior. Here you can see that one is a long thoracic nerve, and here this muscle is a serratus anterior. So if the injury of long thoracic nerve occurs, it will lead to the paralysis of serratus anterior. That one is a winging of scapula, and the appearance of winging of scapula. The scapula have a wing-like appearance in case of injury to thoracic nerve. Okay, the medial and inferior angle of scapula pull markedly away from the posterior thoracic wall and give a wing-like appearance. So you can also say the scapula moves laterally and posteriorly away from the thoracic wall and give a wing-like appearance, especially the medial border of scapula. Okay, what are the causes of winging of scapula? First one is a knife fight weapon, especially a bullets towards the thorax, and the most important clinical presentation is mastectomy. What is mastectomy? Mastectomy is a removal of breast due to some cancerous growth or other causes. So if there is a mastectomical process, mastectomy surgery, so it is very common that there will be a injury to long thoracic nerve. Okay, so what are the indications of winging of scapula? First one is a person is unable to elevate limb and impairment of abduction of, yeah guys, above the horizontal position of upper limb. So if the arm is raised, then scapula has wing-like appearance. So it is a important clinical manifestation of winging of scapula. So that was our 2 days lecture. I hope you have enjoyed it.